Hi, I'm Kelly Murphy, the Director of Early Childhood and Maternal Health at Families USA. Today, I want to talk to you about an issue that's top of mind for us here at Families, the impact of the novel coronavirus on children. As our nation confronts a public health threat greater than any we've seen in a century, every person, every patient, every family is struggling to understand and manage the devastating and far-ranging effects of coronavirus. The effects on their health, the health of their loved ones, caregivers, healthcare providers, the effects on their communities, their jobs, and on the healthcare and social services systems that serve them. At Families USA, we've been working hard to ensure that America's families are getting access to comprehensive, affordable health coverage, that states get much-needed fiscal relief, and that there is a comprehensive effort to test, trace, and quarantine individuals in order to reopen the economy. In addition, we are working to ensure that children's health and well-being remain a focus. Let's talk about how kids are impacted by coronavirus. The good news is that according to a study released last month by CDC, children make up a very small portion of American coronavirus cases so far and are significantly less likely to become seriously ill than American adults. Experts have noted that compared to other respiratory diseases, this one is unique in the low numbers of severely ill children. So although children make up a relatively small portion of the coronavirus patient population, the crisis is still having a devastating impact on children's health and well-being. Every aspect of children's daily lives have been disrupted by COVID-19. School, childcare, lack of access to doctors and other providers, increased family stress, job loss, and increased anxiety related to isolation. These are just some of the ways that children's routines have been upended. Children are losing health insurance coverage as their parents lose their jobs, and while coverage is immediately available in Medicaid and CHIP, there's also a risk of kids slipping through the cracks as their families are struggling to manage the multiple impacts of the crisis. With providers closed, kids are missing well childcare, including important vaccines and developmental screenings. So, how can we help? We can work to ensure that children are included in federal legislation, and to do that, we are focusing on three important areas. First, we can increase coverage. Congress can increase the federal matching rate to at least 12%, extend the maintenance of effort for CHIP, eliminate waiting periods, and maintain CHIP's enhanced funding levels. Second, we can provide additional funding for important programs, including child welfare, home visiting, data collection to improve care for pregnant and postpartum women. And third, we can work to stabilize children's routines through innovative approaches. Federal regulations and rules can be relaxed in order to foster new approaches to support both children and families. For example, the use of telephonic communication in home visiting programs and pediatric visits. And one last example is continuing school-based meal programs to ensure food security for children while schools remain closed. At the end of the day, kids may not be represented in large numbers among COVID patients in hospitals, but we know that they have a lot at stake in how policymakers respond to the crisis. We urge you to keep kids top of mind as you develop policy solutions, recognizing that we have a lot to learn about both short-term and long-term impacts of the crisis on children. Our team at Families is keeping kids at the forefront of our work. Please reach out if we can be helpful. For Families USA, I'm Kelly Murphy.